Well, we are kicking off Lung Cancer Awareness Month by taking a closer look at the deadliest form of cancer for both men and women here in Illinois. Christina Hamilton is a director of advocacy for Illinois for the American Lung Association. She's joining us now live, as you see her there, to talk a little bit more about these stats. So I got to repeat this. It is the leading cause of death in Illinois. How much do we know about the why, and are there areas of Illinois that are at higher risk?
Yes, thanks for having me today. Lung cancer is actually the leading cause of cancer death nationwide and in the state of Illinois. We see the highest rates in central and southern Illinois. Nationwide, the rate of new lung cancer cases is about 54 people per 100,000. In Illinois, it's 59, but in some parts of the state, it's 83 per 100,000, 75 per 100,000. So we do see quite a bit of disparity. Over 560,000 people are currently eligible for screening, but the screening rate is less than 6%. So we really need to raise awareness about lung cancer screening and get people able to diagnose their lung cancer earlier when it's easier to treat.
And all right, let's talk a little bit about that early diagnosis. As you said, early detection can be key in a cancer diagnosis in treating it. So explain how much of an impact that can have, and what does that mean, the early screening? What should they be doing?
So they would undergo a low-dose CT scan, it lasts a couple minutes. They would lay down and go through a machine, and the machine would take different pictures of their lungs and give their healthcare providers a good view of what their lungs look like. So it's not invasive. Again, it's very quick. And it's recommended for people who are at high risk for lung cancer. So those that have a smoking history, they're either a current or former heavy smoker, and they're over the age of 50. But you can contact the Lung Association and find out if you qualify for lung cancer screening. So the phone number is 844-ALA-LUNG. Again, that's 844-ALA-LUNG. We also have a website, lung.org/LCS-assistance. And this is a program funded by the Illinois Department of Public Health for individuals who are uninsured or underinsured. They can even get their screening paid for. They can also get transportation assistance. There's wonderful healthcare providers that can give you counsel and support should you get a positive diagnosis. So it's a really amazing resource to support patients and their loved ones. So we really want to make sure that people are aware of it.
This is a great time of year to talk to your family members about it. I've always heard this sort of formula, I guess you could call it, where if somebody had been a smoker for 20 years or smoked more than 20 cigarettes a day, that perhaps that would be sort of one of the factors that you would take into account on whether they would get one of these free screenings. How much do you know about that?
Yes, so the screening guidelines are recommended for people who have a 20-pack year history, as you mentioned, so that's smoking a pack a day for 20 years or 2 packs a day for 10 years, and they're a current smoker, or they quit within 15 years, and then they're in between the ages of 50 to 80. And then for Medicare, the upper limit is 77. So again, if you think you qualify, you're kind of in that category, definitely talk to your healthcare provider, call our helpline to get more information. And if you do fit those guidelines, your screening will be covered by insurance.
All right, Christina Hamilton, thank you for bringing us this information. If you're interested in more, you can go to the website. You can get a free lung screening. We will share details on our website, WGNTV.com. Have a good afternoon.
Thank you, you too.